Doing today? My name is Devin Lake, and I'm here to talk to you about the origination of phobias. To start off with, phobias is an extreme fear of something. It's an extreme fear also with aversion to some sort of danger. Now, first off, biologically, number one, we're intended to be fearful of certain things. Our animals are even fearful of certain situations and other things. For instance, anything that's dangerous to us, we typically would try and avoid, which is where the aversion comes in. And therefore, we are fearful, heart rate increases, blood pressure increases. It's a fight or flight response that every living thing has, as far as I know. Number two, the actual origination of phobias is actually from the Greeks, right? So the main origination of how it came from them was Ares, his sons, Demos and Phobos. So Demos is basically meaning terror and dread, and Phobos is meaning panic, flight, and rout. So the main original word is actually from Phobos. So the main word is phobo, meaning panic, flight, or rout. And the main first writing reference we found is from Hippocrates in 470 to 410 BCE was the first actual written document that had anything to do with a phobia. Hippocrates was actually describing one of his patients, Nicanor, who was terrified of the flu. Hippocrates actually found out that the situational part of this was during the day, Nicanor was not afraid of the flute, but at night when he was out in town, he actually became fearful and frightened of the sound of the flute or if he saw someone playing it. Now, the first person to actually use the word phobia in any sort of word is Celsus. Which was 500 years after Hippocrates. Keep that in mind. Celsius was actually the first one to describe one of his patients who was fearful of water. He used the word hydrophobia, which is literally the fearful of water. Hydro, water, phobia, fear. In our modern age today, though, we have three specific categories. One being agoraphobia, meaning the fear of basically a public situation, public area where you fear that you can't get out or feel entrapped. Social phobia, this can come from any one-on-one social or other situational public speaking sort of thing. It is the fear of being in front of people and tensing up in those situations. Fear or aversion. Specific phobias are basically everything else, categorizing to fear of snakes, water, heights, all sorts of things. And those are the three main categorizations of modern phobias. Thank you.
The disorder I chose to cover was claustrophobia. Claustrophobia is an extreme or irrational fear of being in an enclosed space. It can be triggered either by being in the confined space or even just by thinking about it. Claustrophobia usually originates in childhood, at a young age, because of a certain experience that left the child with an association between small spaces and a feeling of fear. Those with claustrophobia will suffer from fear in places like elevators, airplanes, cars, crowded places in general, automatic car washes, and even their own basements. Therefore, they will avoid places like this completely. Those with claustrophobia will avoid elevators and will take the stairs, no matter how many flights they have to go up. If they do find themselves in a small space they feel uncomfortable in, they may suffer from hot flashes, chills, shaking, sweating, and even panic attacks. There are multiple different treatments for claustrophobia. One of the more common treatments is the cognitive behavioral therapy that retrains the client's mind to not fear being in an enclosed space. This can be done by putting the client in different situations that may cause them anxiety, like a closet. Another way that claustrophobia can be treated is through medication. Although this does not solve the root of the problem, it reduces the symptoms and the anxiety. Claustrophobia is very difficult for those who deal with it. There are so many places we come across in our daily lives that those with claustrophobia would find it very hard to deal with. Those with claustrophobia find ways to deal with their surroundings, which mostly is dealt with through avoidance. For example, they might never travel, just to avoid enclosed spaces such as trains, planes, or cars. Think about all the enclosed spaces you've been in today. How would it change your life if you had claustrophobia?
The typical age of onset for animal phobia begin in early childhood around 4 or 5, but it's also common for the onset to be in the mid-teens.
The fear of dogs, and people who have this fear may have this reaction.
Ornithophobia is the fear of birds. Those who have ornithophobia may avoid going to parks or anywhere where they could potentially see a bird. They may avoid going out during the day because birds are everywhere, but they will go out during night because it's less likely that they will encounter a bird. Those who have ophidiophobia have the fear of snakes. People who fear snakes will avoid high grass areas, parks, or any outdoor place where the potential of running into a snake exists. Those who have zoophobia have fear of animals. They may avoid going outside to zoos and may cancel plans with family or friends in fear that they might run into an animal. This could significantly impact someone's life.
So today we're working with Caitlin, and she has cynophobia. Caitlin, can you tell me what you feel when you think of a dog or see a dog?
I feel anxious and scared and nervous.
Mm-hmm.
And I just don't like to be around dogs. And it's not like a normal fear. It impacts my daily life where I don't even like to think of dogs.
Okay. So what we're going to try is systematic desensitization, and she's made a list of her hierarchy of fears with the thing she's least afraid of is seeing a picture of a dog, and then it goes to having a dog in the same room, to being near a dog, to petting a dog. And so we've worked on some breathing techniques and relaxation techniques for her to try. So we're going to see how she feels when she sees a picture of a dog and see if this can work out. So we're going to start with having her see a picture of a dog and have her use her breathing technique and see how she feels. So let's go ahead and try and look at the picture. Okay, so how do you feel? You okay? Breathing helping?
I feel a lot better now with my breathing technique.
Okay, awesome. So now we're going to move on to having a dog in the same room. So deep breaths. We're going to see. Okay, it's in the same room. How do you feel? You doing all right? Breathing good?
Nervous.
Okay, just some deep breaths. Now let's see if we can get you to be near the dog and see how that works. Okay, you all right? Breathing good?
Mm-hmm.
Okay, so let's address petting a dog. See if you can work that out. Okay, awesome. How do you feel? Good? Okay, awesome.
Go. Hi, so my name is Shai Deval, and our topic of choice today is going to be agoraphobia, which known by the Greeks is the fear of the marketplace. So basically people that have agoraphobia have a fear of public places. For instance, like how I'm outside, they would not want to come out here because they have a fear of their panic attacks and people coming and flooding upon them so that they can't escape. And also they have a fear of the embarrassment that comes with having a panic attack, because all these people that are coming and rushing in think they need help, but these people have gone through this for years and they know that they don't need help, they just need a place to calm down. So these people stay at their homes with close family and friends that are there to run their errands. The prevalence or / age of onset for people with agoraphobia is their early 20s, and usually most of them are diagnosed with some form of an anxiety or panic disorder that has maybe possibly led to the cause of them having agoraphobia. Most people go through treatment, which is considered desensitization, which is basically going through their fears one by one till they reach the ultimate fear, which would be, for example, going to the place where they had their first panic attack, which has led them to be confined to their home. So stay tuned for more as we meet with one of my personal friends And we also get an insight on a desensitization therapy. Thank you. So hi, welcome back. Here we are with my friend Angela. She is a patient of a person who has agoraphobia, and she's here to speak with us today because she's now been able, through therapy of desensitization, to come outside and sit and talk with us today. So Angela, how is it having agoraphobia?
It affects your daily life on a regular basis. It makes it very hard for me to go shopping by myself, or even to do it on my own, I should say. I just have a fear of people rushing me and having a panic attack out in society. With the disease, you also have a lot of anxiety and depression. I do have a close-knit family and friends that I like to come to my home and visit with me and run my errands and things for me.
What age did you start having agoraphobia?
I think it's about the age of 23 was the first onset. It started with anxiety, depression, and then one day at the grocery store, it just happened. And it has affected my life ever since, now at age 39. But life is getting more easy. I'm able to come out, as you can see, and sit outside and enjoy the weather. With the therapy I have begun, I should say behavioral therapy, I have begun doing. There's not much medication to treat the disease itself.
So, how has this behavioral therapy been going for you?
Very, very well. As I said, it has allowed me to be able to at least come outside and enjoy the weather. I haven't made it as far to go out into a public place at this time.
But you are working up to that?
Working very hard up to that. Like I said, there's not a medication that can directly treat this disease, but I do take medication for the anxiety and the depression.
Thank you for coming with us today. Please stay tuned because we have an inside exclusive to see a therapy session.
Again now.
Hi, so today we are here with my patient, Angela Vall. We have started doing a desensitization therapy these past couple of weeks where we think about things that she least fears and we will work up eventually going to somewhere that she fears the most. So Angela, I'm going to need you to close your eyes and I want you to think of the place that you have feared the most to go out in public. What is that place?
It would probably be the grocery store since that's where my first onset ever happened.
Now imagine you walking through this grocery store.
Okay.
How's your anxiety level?
It's slowly building.
Now you're getting farther to the grocery store where there's more and more people starting to appear. How is your anxiety level now?
Very high. Very high.
Do you feel you getting a panic attack?
Yes, I can feel my breathing starting to pick up and my ears are starting to ring.
Is your heart racing?
Yes, ma'am. I can feel it beating in my throat.
Well, now you get to leave the grocery store.
Okay.
How do you feel now that you've left and you're in the car?
Much better. It's coming down.
So what would you say your anxiety level is now?
Probably like 5.
A 5? And what was
5 out
it?
of 10.
And what was it when you were in the grocery store?
Oh, probably like a 9.
A 9? That's very high. So as you can see, I've tried to do the imagining technique, which is where she imagines herself in a place. And as we get further into therapy, we will actually go out to these places and see how her anxiety goes. Thank you for watching.